everyone, happy Kinnerversary! Cancer Kinship is officially 2 years old as of this month, November 2020. And in a weird way, it feels like we've been around for many, many years, but at the same time, it feels like we just launched the other day. So it certainly has been an interesting 2 years. And I thought for sure that year one was going to be the most challenging year of them all because it takes so much just to get an organization off the ground, to secure funding, to launch programs, to basically set up all of the organizational infrastructure things that one must have in place to start an organization. But honestly, year one was a cakewalk compared to this past year, obviously due to the pandemic. But it has taken a village for us to reach year two. And I'm just grateful. My heart is overflowing with gratitude to each and every one of you for being a part of our Kinner Circle. For those of you watching, you may be a participant, a volunteer, a community partner. Each and every one of you have played a significant role in our organization's growth. And like I said, I'm just so grateful to each and every one of you. Thank you for being a part of our family. So we've been hard at work here at Cancer Kinship as we prepare for 2021. It is budget season, so we've been crunching numbers. We're planning our program expansion for next year. There are a lot of cool programs on the horizon that we're going to be sharing about really soon. We're also going to be sharing our 2020 impact report so that you can see what we've been able to accomplish with your help. So more to come on those two things, our program expansion and our impact report. I do want to share briefly a couple stories that basically demonstrate the type of support that we provide or that we have been providing, especially during COVID. Like I said, it's been extremely challenging, not just for the cancer community, obviously for everyone, but the community that we serve has really been experiencing extreme isolation and loneliness, lots of fear, and of course the challenges from losing a job, losing insurance, not being able to pay for insurance or losing medical insurance, not being able to pay for rent and food and out-of-pocket medical expenses. So we've been receiving a lot of phone calls for resource navigation, and those calls are a bit challenging because the needs of the cancer community are so diverse, and they're all critical needs. So the way we've been able to support in that area of resource navigation is to really just help prioritize the needs of the community member and help connect them to resources through our partnerships so that they're not just receiving an email or a phone number, that we're actually making connections and making sure that the client doesn't fall between the cracks. So a couple stories. We received a phone call a couple months ago. This story really stands out to me because of the depth of need. It was actually a family member of a cancer patient that had contacted us because he was concerned about his mom. She did not have medical insurance. At that point, she hadn't seen an oncologist, but had received a cancer diagnosis in the ER because she was experiencing severe symptoms, and it looked like she wasn't going to make it, actually. So anyway, this family hadn't worked in a long time because of COVID, didn't have income coming in. They were behind rent 2 months. Tags were about to expire in the car, so the son was worried about how he was going to take his mom to treatment, how they were going to put food on their table, just so many needs. And because of our partnership with the Melinda Hoag Smith Center for Healthy Living, we were able to get food on the table, or food within the hour. It had helped them navigate through insurance so that their mom could have the medical insurance that she needed. She had an oncology referral. And now a couple months later, I found out that the family is a little bit more stable now. Mom has a little bit of has a bounce to her step, and you know, she's still dealing with a critical health issue, and is still dealing with advanced stage cancer, but she has hope and she's more stable and she's being seen by a doctor. And it's so great to know that this family who was struggling with so many issues now is on their healing path. And, you know, I understand firsthand what it's like to have a family member who's going through medical distress, who is underinsured and doesn't have the medical care. I went through that with my sister. And know what that sense of urgency feels like, and also knowing that your hands are tied, there's nothing you can do. And when somebody gives their hand out and says, hey, let me help you, that makes such a huge difference. For me, that help came through a nurse navigator at St. Joseph's Cancer Center. Her name was Angela. She was amazing, and she helped prioritize my sister's needs so that within weeks my sister was insured, had an oncologist appointment, had all the specialists lined up. Unfortunately, my sister's cancer was advanced stage, and even though she didn't make it, because of the support that she received, she was able to die with dignity. So we hope that this patient doesn't die. We are rooting for her and supporting her, and really want to support her as she continues to heal and navigate through her health situation. But again, it's the intervention that matters and the support that matters. Another quick story, and I'll end with the story because this video is going a little long, but you know, last week I received a phone call from a healthcare professional, a registered nurse who was prepping his patient for a procedure, a quick surgery. And this patient had revealed to him that she just got diagnosed with cancer and was very scared, was very emotional, was crying, and he felt the need to connect her with somebody that could help give her hope as he was preparing her for the surgery. So he reached out to me, asked if I could connect with this patient, and through video chat. So we connected through Facebook Messenger, and I had a FaceTime or a conversation with this woman through video chat, and she was indeed very emotional. A comment that she made, and this just proves that suicide ideation is a real thing. And even though a patient may not have a plan to follow through, there are thoughts that come into your mind when you're so scared. A comment that she made that struck me, that really crushed my heart, but also I knew that the intervention was necessary. She said, please don't wake me up from this procedure. I don't want to live. Like, I don't want to wake up. I just want to die. And a comment like that comes from a place of fear. And thankfully, she had medical professional staff that were there on hand to support her in real time. That there was a cancer survivor, me as a cancer survivor, that was on the call to say, hey, I know what that's like. I know what this procedure that you're having is like. You're going to be able to wake up from this and take some control back by handling your nutrition or looking at your nutrition options, having conversations with your doctor and asking the right questions. And there are options. The surgery that you're going through is survivable, and more people are surviving breast cancer. So I understand how scared you are, but there's so much that you can do when you wake up to take that control back, and you're going to be okay. So, you know, she just needed that listening ear and someone to give her hope. And when she woke up from her procedure, I did receive a text message. I saw her registration come through for our mailing list, and she mentioned to me through text that she wanted to stay engaged and wanted to stay in touch. If she had questions, could she reach out? And I heard from the RN that she seemed in better spirits. So again, these interventions help bring hope to people who are feeling hopeless and scared, and there's a lot of work to do. So I'm getting emotional. I don't want to get emotional. I just know that our programs work, and we need help growing our programs, bringing in more people, more volunteers to support patients like this patient who is feeling hopeless at her most vulnerable time. So Anyway, I will end with that. Tomorrow's Giving Tuesday. Please consider supporting us in many, many ways. Check out the ways in which you can support us tomorrow on Giving Tuesday. And we look forward to staying in touch with you. So thank you guys so much for helping us celebrate our 2-year anniversary. We have lots and lots of work to do as we move into 2021. And we look forward to staying engaged with you as we continue to grow our organization. So bye guys. Thank you so much and happy Kinnerversary. Bye.